you know, often because the way the industry works, we might end up in a role that's just focused on one particular health area or content area. But what's really great is that you develop those key core skills like stakeholder engagement and management, project management, evaluation, which you really can translate over to any content area, because the content you can learn, the health topic you can learn, but it's those key core skills that take so long to build up.
Welcome to the Public Health Millennial Career Stories Podcast, episode number 12. Hi, everyone. My name is Amaya Richens. Thank you so much again for joining me once again for another episode of this beautiful show talking about public health stories. I hope that you've gained some value and definitely gotten some advice and some tips throughout these 12 episodes. Well, this will be the 12th episode. I'm really glad for you joining me, and I appreciate everything that you do. So thank you for supporting the show. If you can just go ahead and leave a review if you haven't as yet, and make sure to subscribe and share this with a friend. I would greatly appreciate that. And I'm really happy that this episode, we are taking you to another continent, and I'm getting to talk to a public health professional in a country that I haven't been as yet, but I'm really excited. I'm really glad that I got to talk to this person, and I hope that you enjoy. So without further ado, here is today's episode. This is the Public Health Millennial Career Stories Podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Today we have someone from the land down under, as they say. She completed her bachelor's in health science and health promotion from the University of Queensland in Australia in 2015. She has worked at Queensland Health as a health promotion officer and senior health promotion officer. She currently works for the Healthy North Coast as a population coordinator. Additionally, she's recently launched her public health website at thepublichealthnerd.com. We have Ava James. How are you doing today, Ava?
Hey, I'm really good, thanks. It's a little bit cold here in what's usually sunny Vegas, but trying to keep warm. So I'm a bit rugged up.
And that is awesome. And it's funny because you are in wintertime right now while we're in summertime.
Yeah, we're pretty lucky here though. Like I'm looking out the window right now and it is beautiful and sunny, and I actually haven't checked the temperature, but like it's not really that cold. We don't get much of a winter in Brisbane.
Okay, that's awesome. So how have you been coping during like these times with COVID and everything going on?
Yeah, I think first of all, we've done a really good job in Australia with COVID. So I think that's pretty important to acknowledge. And I think me personally, I've been really fortunate and lucky to, I guess that the pandemic hasn't really personally affected me. So have been very fortunate in that I've, managed to stay employed. I actually started a new job during lockdown. So that was interesting. I've had lots of, it was really tough at the beginning, watching lots of friends lose jobs and family close businesses, and when we really didn't know what was going to happen. But again, I think we're really fortunate here. Our government really stepped up and supported people who weren't able to work. So yeah, I think all in all, feeling pretty blessed and grateful, and it's really made me reflect on a lot of things, having so much extra time, and just how much I appreciate the things that I love in life, like spending time with my family and going for walks on the river and reading books. And I've definitely missed soccer. I've missed that a lot. But yeah, all in all, feeling very grateful, really.
Okay, that is awesome. And what team do you support, if I may ask?
Oh, so I I don't have, like, I don't go for an English Premier League team. I don't really follow any of those. Probably what most people who follow football or soccer would know, but I'm a very big follower of women's football, or soccer. So I follow our national women's team, the Matildas, very closely. I went to the Women's World Cup last year and just watched as many games as I could really. So, and now that a lot of the Australian women professional players have moved over to the professional league in the UK, so I'm starting to follow some of those. So, you might have heard of Sam Kerr. She's a pretty big superstar in terms of Australian soccer players. So she now plays for Chelsea. So I think I'll have to be a Chelsea supporter now.
Okay, that's cool. That's cool. And thanks for sharing that. And it is refreshing to hear that Australia is doing a good job and that the leadership and the government has really taken action and put things into place. Unfortunately, I cannot say the same for the US, but hopefully things are going to get better here. And yeah, so tell us about your personal background.
Yeah, so I grew up in a really small town in a regional area in the state of New South Wales. So northern New South Wales, quite an alternative area, well known for hippies and recreational drug use, and pretty simple life. My mum was a nurse growing up. My dad was a musician. So yeah, like life was simple. Weekends are spent riding bikes and swimming in the local creeks and just hanging out with mates. And I guess, not everyone went to uni in my family. So that was always really something that I wanted to do, though. So really strive towards that, and probably didn't even really consider actually that I would be able to go to uni until I was in my last year of high school.
Okay, and I feel like it's kind of similar for me with university because I remember like we had a senior day and I went up to say a speech and I was like I never really thought about going to university and now I'm going to university and I got very emotional, but that's for a different time. Thank you for sharing that and I appreciate that. So you live in Brisbane right now, correct?
I do, yeah. I've been in Brisbane for about 10 years. So, as I said, grew up in a small town. And when I finished high school, I couldn't wait to get out of there. So, Brisbane was the closest big city, and I had some family up here that I knew. So, it's about a 2.5 hour drive from where I grew up. So, I was ready to leave the small town and get to the big smoke.
Okay, okay, that's awesome. So what does public health mean to you?
Yeah, so I really had to think about this because it is a tough question, and I find it so hard to explain to people what I do for work. But for me, public health really means taking a very holistic approach to understanding the cause of ill health and really to support and protect the health of populations and the planet.
Yeah, and I love that you added in the planet too, because I think that that's a aspect that usually gets forgotten, but it is very important, and it kind of is interesting to see because with COVID and everything going on, climate change is still happening, and yet it's been put on like the back burner when it should be always at the front of everything. But I guess that's how pandemics treat things and change things and what have you. So, where did your public health journey begin?
I'd say it probably began maybe in my second or last year of high school. I wasn't really super into school. I was never the academic kid. I was always this, on my report cards, it would always say, Eva has great potential, but, needs to apply herself more. So I was book smart, but I just didn't really care about school until I had a really good, so in grade 11 and 12, my last 2 years of high school, I had a really great health teacher, and took health as an elective subject. And so we did things like the physical activity and biomechanics and sport, but predominantly a large portion of it was around learning about the social determinants of health and social policy and health systems and healthcare systems around the world. And I just loved it. And I had a really great teacher who I can't thank enough now, because she brought out the best in me, and I absolutely found my love for health. I think, growing up with mum being a nurse, it was always there, but I found something that I loved and that I was good at. So yeah, I think that's probably when it really started for me.
Okay, and that's awesome. That's cool that you learned about like social determinants of health while you were in high school. Like I didn't learn about that until maybe 3 years ago. So yeah, that is definitely awesome. So what what made you decide to want to pursue a bachelor's in health science in health
Yeah,
promotion?
Yeah, so I guess as I said in school, I really enjoyed it and had that great teacher who also she was studying while she was teaching. She was studying a master's in international health, and she'd done aid work over in Africa and had all these amazing experiences. And I just really learned a lot from her. And I actually originally wanted to be a doctor, so I thought that I would do health sciences as an undergrad and then go on to pursue medicine. And I know that that was something that you were thinking about as well. And I think I found this course where it was base sciences, but then you could pick a major and it did have more public health focus. So I think my original major was public health and health promotion, and then it changed to just health promotion, but predominantly had a really strong public health focus. But you still got to do your base sciences like anatomy and physiology and chemistry and those things. But I pretty quickly learned that prevention was my jam,
Hmm.
and it just resonated with me, and it just stuck with me. And I still kind of toyed with the idea of potentially going on to do medicine at different times, but the more I stuck to it and the more I learned, I knew that I it was what I had to do and it was what I wanted to do.
Okay, and if you could remember like the first moment that like caused like doubt, saying that, oh, I don't really want to become a doctor, I want to pursue like public health. Do you know what that moment would be?
Oh, I can't think of a particular moment, but I remember, doing some of our first year at uni, doing some of those intro to um, health promotion courses, and it was just like, what? You mean there's a concept where we can prevent disease at a population level before people actually get sick and end up seeing a doctor? And I was just like, yeah, that just makes so much sense. Like that's for me.
Okay, okay, yeah, and I absolutely agree. When I realized the same thing, and like Australia does a lot of things better than the US in the healthcare system side of things, and looking at how, okay, like if we're just gonna compare Australia to the US spends probably like two times the amount of GDP on healthcare, so it's a much more expensive system, but it has worse health outcomes. We have shorter life expectancies, we have higher infant mortality, higher maternal mortality, and all those different things. So it is really interesting to look at that, and yeah. Okay. But anyway, um what were your like experiences like in your undergrad?
Yeah, my experience, I often look back at undergrad and more, I wish I'd made the most of it because I really don't think that I did. I didn't really get involved in uni culture. Um, I, I just feel like I really could have made the most of it, but yeah, I guess I had again, like my academic journey wasn't this clear cut path. Like when I started uni, I had some personal stuff going on in my life where I wasn't really able to apply myself, and I didn't get off to a very good start. Like I ended up failing a bunch of courses, and then actually wanted to quit uni. So I kind of just thought maybe this isn't for me. Maybe I'm not cut out for this, for uni. Um, and I think I did actually take some time off. I think I might have taken, or I dropped back significantly my course load and just really focused on myself and getting better. And then kind of got to a place where I was feeling really, really good and really positive and healthy. And I was like, you know what, I'm going to give this everything I've got. And I did. And then I actually found out I was pretty good at it. So there was a couple of courses that I'd failed and then ended up getting, the grade systems are probably different in the US, but I got and failed, and then I got high distinctions, which is the highest grade you can get. So, um, yeah, and then I think that just really gave me a confidence boost to keep going with it. And because there was so many times where I thought I'm never going to finish this degree, I'm never going to get through it, but I just kept persisting, and had really good supports around me. And the better I did, then the more confident I grew, and was able to really not only get through it, but do quite well in the end. So, but I do feel like I should have made, yeah, like I said, I just don't think I made the most of uni life.
Yeah, fair enough. But I'm glad that you took time to figure out yourself and then thrive afterwards during your journey. And yeah, and definitely having like that support system, and I guess seeing the all the good work that you're doing and getting the good feedback from the classes that helped you in that sense. So I'm glad to hear that, and I'm glad to have you on the show right now to talk about all the experiences. So I know you were a project intern at the Queensland Aboriginal and Islander Health Council. How did you get that position, and then what did you do in it?
Yeah, so as part of my undergrad, we did a semester, or one of our subjects in, I think it was in final year, was a prac, I think it's called a practicum. So where you essentially do an internship for a semester. And I can't remember the exact amount of hours. I think it was maybe 90 hours over the semester. So it wasn't huge. I think I did 1 day a week for maybe 13 weeks. And so I guess fairly lucky and grateful that our uni organised that as part of our course, but we did get some choice over what we were interested in. And so I was really interested in Aboriginal health, and so put that as a preference when talking with the course coordinator about where I'd like to go for my prac. And I'm so grateful that I got placed where I did, because I had an amazing facilitator and supervisor through that prac experience. And she really threw me in the deep end a lot of the time. I remember, first, I think it was my first or second day, and she said, "Oh, do you want to facilitate this presentation with a bunch of health workers?" And I was like, "Sure." All right, let's give it a go. So yeah, I guess the project that I worked on as part of that experience was around, so my facilitator, or the supervisor that I was working under, she was leading a project that was looking at the health and well-being of Aboriginal health workers. So in Australia, we have a number of what we call community controlled health services, and within that we have a number of different clinicians, but we do have dedicated Aboriginal clinicians as well. And um, yeah, so it was just around supporting the staff in those clinics and making sure that their health and well-being was looked after. And so I'm trying to remember what I did. It feels so long ago now, but there's a few things I did. Lots of data entry for some of the evaluation for the project. So yeah, entering data, analyzing data. It was the first time that I'd actually had much experience with Excel, so that was proved to be very helpful later on. And then there was also a bit of a social marketing campaign that I worked on as well. So working on coming up with a storyboard for a video that was happening as part of the project. But yeah, such a valuable experience.
Okay, and if you had to take away one thing that you learned from that, what would it be?
Maintain your connections and your network,
Yeah.
because I still have a relationship with my supervisor, and I haven't seen her for quite some time now, but every now and then we'll check in and catch up. And it's just really nice to have those supports as you go through your career and have those people to get advice off. And she was actually the first job that I went for outside of uni. She was a referee.
Okay. Awesome. So you had another job or internship during undergrad as an administration officer, health promotion for the Metro South Health. So what was that
Mm.
position about?
Yeah, so that was actually my first job out of uni. So when I graduated uni, or probably I think it was either my second last year or last year of uni, the state of Queensland, which is where I live now, a couple of years before I graduated, the state government essentially almost abolished preventative work or preventative positions and health promotion positions. So I think the workforce under the state health system had, I'm just throwing numbers out there, but just to give an example, maybe about 100 positions across the state. And then they essentially cut that right down to just maybe 10 positions, and mostly centralised it into a head office within Brisbane. So that was pretty demotivating as a student wanting to get into that area for work, that I was like, okay, well, there's no jobs. And I really wanted to work for Queensland Health. But yeah, there was just that the outlook was pretty grim. So I actually thought about changing careers or going back to study again, but I was pretty determined, and I thought, you know what, I'm going to give this a go, and I'm going to see what I can get, and I'm going to try and get anything that gives me some kind of experience within the health system closely related to what I want to do. So I set up some job search, like automated searches, and then I remember I'd been away for the weekend. I remember driving in the car, checking my email, and I saw this email pop up, and I saw a job with health promotion in the title, and I was like, oh my god, because they're very rare. They, you know, if you did a search in Queensland at the moment, you'd be struggling to find one job in health promotion. So it was an administration position, very entry level, low level. You didn't need any university qualification, or I don't think you needed any qualification to apply for the job. And it was just a temporary position covering someone's maternity leave. So yeah, went for it. Got my sister to help me with the application because I'd never done a government application before, and it was like reading another language. So yeah, that was my first kind of taste of working in health.
Okay, that's awesome. And I'm glad that, well, I guess I'm not that glad, but it kind of sucks when jobs aren't there, but you still pushed on and look for the opportunities that you could find and get the experience that you needed at that point in time. So for job searching, what apps do you use in Australia?
Yeah, so I mean, we use LinkedIn. Seek is probably the biggest one here. Indeed, Ethical Jobs, the main, and then each government agency will have their own website as well where they post jobs.
Okay, awesome. Thank you for sharing that. So I guess you transitioned from this role into a health promotion officer at Queensland Health. So was that a promotion that you got in the role, or was it an application for a different role completely?
Yeah, so it was an application for a different role in a completely different area. I was only in that admin position for a few months, and then it was actually my manager who was qualified in public health who saw this particular role, the health promotion officer role, and she said you should apply for it because she obviously knew my background and where I wanted to go. And I thought, okay, I think it was a 6-month contract, so applied for it. Went, did the full application and interview process and got the job. And that I know that there is no way that I would have got that job if I hadn't have had, even though it was only a short amount of experience working within that health service. Yeah, I just really don't think I would have got that job. So it just goes to show what, even though I wasn't working in a direct public health or health promotion role, I was able to transition over to a dedicated role that I actually did need my degree to go into.
Okay, awesome. And so what did you do in this role?
Yeah, so it was based at what's called the Health Contact Centre, which is a centralised call centre within Queensland, state run, and delivers statewide services. So a range of clinical and preventive health services as well. I think the centre has like over 11 services now, but predominantly the service that I worked with was the Quitline service. So I was working in a dedicated health promotion role with a really strong focus on tobacco and smoking cessation. And really my role was about looking at, how can we partner with different organisations to ensure that we have appropriate referral systems in place, that uh, brief intervention is integrated into clinical care, and then that they are being referred on to the Quitline service to receive comprehensive support and counselling to quit smoking. Yeah, lots of, I think, but then also looking at our reporting and evaluation systems and how we were kind of, reporting what we're doing and showing our outcomes and making sure that our funder was happy with what we were doing as well.
Okay, awesome. And who was the funder?
Yeah, so the Quitline service in Queensland is funded by state government or Queensland Health.
Okay. Okay. And then I also saw that you were a casual academic for the University of Queensland. That I don't know what that title means, but it just sounds kind of cool.
Yeah, it's a bit of a funny one. That was what was on my payslip, but essentially I was a tutor, so I majority ran tutorials. I think so. I would tutor for. There was two subjects that I taught for, and so I'd run. I think sometimes I'd have like 3 back-to-back 1-hour tutorials, and then in each tutorial there would be anywhere from 20 to 30 students. And then I did do a guest lecture, and also part of that role was marking assessments.
Okay, and were these like first year, second years, third years?
Yeah, so undergrad, and they were first and second year.
Okay, okay. That's a really cool title for a tutor, but I appreciate that. And did you do this simultaneously while you were working as a health promotion officer?
I did, yeah. So I was a few years into my role as a health promotion officer, and I guess through that role, I kind of discovered that I really liked mentoring and teaching, and I had stayed in contact with one of my lecturers from uni, and I just reached out and said, look, I'm really interested in teaching, and do you have any opportunities? And she said, yeah, we'd love to have you. So just connected like that, and it was I think I dropped down to 4 days a week in my job as a health promotion officer, and then would teach 1 day a week.
Okay, awesome. And did you find any challenge in like transitioning from working to teaching or not?
Yeah, teaching, I loved the being in the classroom and having those conversations with students. That part of it I really loved, and I also felt like I was learning again, because I was learning the basics and the fundamentals that so often you actually forget about on the job. So that was really, really cool, and I kind of rediscovered my passion again. What was really challenging was marking assessments, because I'm not sure if marking assessments might actually be worse than doing assessments. And there was a lot of late nights, and I felt like I was like back at uni staying up doing assessments, but I was marking them instead. So I got a whole new appreciation for teachers and the work that they do. And when we're at uni, we're like, where's our grades? We want our grades. But then you understand how much time and effort actually goes into marking people's papers.
That is so true. That is so true. Especially when like professors have a huge caseload too, because they're not only doing classes, they're usually doing research also. So there's a lot
Yeah.
going on there too. So then after your health promotion officer role, you got promoted once again to a senior health promotion officer for Queensland Health. So was this a planned promotion, or how did this go about?
Yeah, so it was still within Queensland Health, but it was in a different area. So different branch, essentially, new office, new boss, but it was still predominantly focused in tobacco control, which was what most of my experience had been in, was in smoking and tobacco control. So it wasn't necessarily a planned promotion. An opportunity came up, a temporary opportunity. So in this particular branch within Queensland Health, who I already had a really good relationship with. So it was the branch that essentially managed the contract between us, where I was based as service deliverer, and them as kind of the funder and contract manager. So I had a really good relationship with colleagues there already who were in those more senior roles, and I really got to, I guess, over my years working in that role, got to learn what they do there as well and build those relationships and connections. And they had I think someone who went away on secondment, so they had a temporary opening, and a colleague contacted me and encouraged me to apply for the role. So I did. I didn't really have high hopes that I would get it because I just wasn't sure if I was really ready to move up to that level. I mean, I knew I could do it, but you know, it's so competitive, and there's just not many jobs. But yeah, threw my hat in the ring, gave it the best I had, and was lucky enough to get that position. It was a really short-term contract. I think I started on a 6-week secondment, so I was able to keep my temporary position and go over to this other area and just do a short 6-week contract. But I ended up getting offered an extension. So at that point, I was in a position where I had to choose between going back to my my substantive position, which again was a temporary contract role. And I was really fortunate in that role because although I was temporary, I kept getting extended for almost 4 years. And I could have gone back to that role, but I actually took a massive risk and I stayed in the senior role. I think I was offered a 3-month contract. So I gave up a 12-month contract for a 3-month contract. I took a risk.
Okay. And is most of the work that I guess happens in like Queensland Health and other government organizations contracted work?
Yeah, permanent positions are really rare in not just in government, but in NGOs as well. Just in public health, yeah, they're just permanent positions are really rare to come across. So most roles and positions are temporary contracts, and often you will, if you do a good job and the organization has the work and the ability to keep you on, you often will get extended. But yeah, it's tough.
Okay, that's very interesting, and that's cool to know, I guess. So you said that at first you had a 6-week contract going to this company. Like, what is your mindset going in there when you have just 6 weeks, and how do you like position yourself to make an impact in those 6 weeks?
Yeah, so yeah, you're totally right. It's kind of like, well, what can I achieve in this time? I think I probably was at a bit of an advantage because I already knew the people who worked there. I knew the systems, I knew what we had to get done, and I already had the content knowledge. So I certainly was at an advantage where I could essentially just jump into that role and hit the ground running. I'd already built up my networks across the state in that tobacco area, so it didn't feel like a big challenge or transition. uh, the work was a challenge, but the adapting to that role and that short-term contract didn't feel as hard as maybe it would be for someone who was just completely going in blind to a new position. But I was also feeling fairly confident that there would be an opportunity to get extended. So I wasn't 100% sure, and that was the risk that I took, but I knew that there was an opportunity. So I think I ended up staying there for 10 months. And that was just, I think towards the end, I was doing month-to-month extensions, which it started to get really hard when it was like that, because I felt like I was, like you said, I felt like I didn't know what kind of impact I could have anymore because I wasn't able to really sink my teeth into planning 6 months ahead or get involved in work that had a 12-month trajectory, because it was like, well, I might not be here, so that's probably not the best thing for for the organization.
Yeah, and that is a very tough like psychological thing that you have to deal with in that kind of environment. So, what was the expanded role for the senior health promotion officer?
Yeah, so I guess at a higher level, you take more of a strategic approach. So, um, at that more entry level and grad level, I was really building my skills and building my networks, but a lot more probably operational focus and ensuring that service delivery was how it was supposed to be, and that our stakeholders were being engaged. But I think when I moved up to that more senior level, I really got to take more ownership and direction in strategic planning. So I essentially got handed a project, an idea, and it was kind of like, okay, develop this, implement it, evaluate it, get it done. So it was just a pilot. So that was really exciting. I got to really take a lot more ownership over a big piece of work.
Okay, that sounds awesome. Did you also have any like managing responsibilities in this role?
No, no. So um, I didn't have any direct reports or anything like that.
Okay. And what, I guess you said you were excited to take on that project and take ownership of it. How was that, getting that project, not having done something like that before and really having to do it, like, I guess, on your own and for the most part?
Yeah, it was challenging. I think again, I was really fortunate because I had built really good connections and networks and knew the health system really well in the state. So that really, I think, certainly helped to make sure that I was set up for success. And also going into, so when I moved into the new role, in the senior role, it was a new area and I was surrounded by a lot of high level senior colleagues who had much more experience than me. And I really got to utilize them and collaborate with them. Use them, sorry, that's not the right way to put it. I mean, collaborate, work together and um, uh, just, I guess, bounce off them and build with them. So that was so helpful for my development professionally and for the delivery of that project.
Sure, that absolutely sounds like a great experience. So I know you talked about like having work in tobacco cessation. Was this something that you learned like during your undergrad, or was it something that you picked up in the roles that you had?
Yeah, it's funny because when I was at uni, when I studied, I didn't do a lot of work in tobacco. A lot more of the assignments and kind of projects that I did at uni were much more focused around physical activity, overweight and obesity stuff, um, nutrition, but I really didn't do a lot of work in the tobacco space. I think maybe I did one assessment and I didn't really know a lot about it at all. I mean, I knew smoking was bad, and I, saw my dad smoke my whole life and saw the effects that that had. But no, I really didn't. I went into the job knowing virtually nothing, and it wasn't it wasn't ever like, oh, tobacco is the area that I want to work in. It was just that you can't be picky and choosy, and you take what you can get. But I'm, so grateful for the experiences that I had, and ended up, those experiences really built such a strong content knowledge in that area. And that I mean, I think at the time there was a time where I was kind of like, oh, I want to do something different. I'm a bit sick of talking about smoking and tobacco all day long. But, there's a lot to be said for learning a content area and developing expertise in that area. And yeah, I don't know where I was going with that. I've lost my train of thought now.
Fair enough. And do you think having been able to learn that during your career makes it easier for you to transfer that to a different like topic area in public health?
Yeah, definitely. And I guess, often because the way the industry works, we might end up in a role that's just focused on one particular health area or content area. But what's really great is that you develop those key core skills like stakeholder engagement and management, project management, evaluation, which you really can translate over to any content area, because the content you can learn, the health topic you can learn, but it's those key core skills that take so long to build up.
Yeah, absolutely. And I think that's so important. And I think that's what a lot of guests on this show are just repeatedly saying is like having those transferable skills, especially early on in your career, so you can build up that because you can always pivot and change topic areas. So moving along, you
Mhm.
switched roles from your senior health promotion officer to a population health coordinator for the Healthy North Coast. So why did you make this change?
Yeah, so as I mentioned, I had been kind of on the roller coaster of temporary contracts for almost 5 years, and for the most part, I didn't really mind. It was all I knew, and it was what I signed up for, and I was mostly just grateful to have a job in public health, because they are quite rare to come across, especially for grads and people in early career. But I did, towards the end, when I was doing month to month contract, I was starting to feel I was just getting a bit over it. Things with COVID were starting to ramp up, and there was a lot of uncertainty about what was going to happen, and I just wasn't feeling as comfortable and safe and secure in doing temporary work. I know that I probably could have stayed within Queensland Health, and um, I could have bumped around to various different temporary contracts, and that would have been okay. But I felt like I wanted to really challenge myself and sink my teeth into something new. So I went on a bit of a job searching spree and job hiring, job application spree. And oh gosh, I can't even remember how many I applied for, but I I applied for so many jobs, and at the beginning it was really feeling quite defeating. I mean, I was like, oh, I'm never going to find anything. But then it was kind of like when it rains, it pours, and I started to get all these offers, and a lot of them were temporary, short-term, 3-month contracts, 6-month contract. But quite a few of the jobs just came through networking. Like I just asked around contacts that I'd made good relationships with and worked with on different projects, and said, is there any opportunities going? So I ended up getting offered, I think, 6 positions. It was extremely overwhelming and a little bit insane, and I almost feel embarrassed to say that. But it, like I said, a lot of them were temporary, short-term contracts and things like that. But the particular role that I'm in now, it was the only permanent position that came up. Although that actually wasn't really the deciding factor in taking the job. It's with a non-government organisation, so it was a big change. I'd only worked in government. It was taking a pay cut, although it was coming with more security. It was also based in another state, so in New South Wales. But the role, it just really interested me,
Okay.
and I think it was across different areas. It was a new role. It really had the potential and the opportunity for the person to step in and make it their own, and that really excited me. And I'd never worked in the NGO space, and that was something that I was really mindful of. That although I could have kept going in state government and getting paid my really nice state government salary and being quite comfortable with that, I felt like I really needed to step out and challenge myself and get exposure to different things in the health system.
Okay, and that makes a lot of sense. So what does Healthy North Coast do?
Yeah, so Healthy North Coast is a not-for-profit organisation. However, in Australia, we have what's called primary health networks. So they were set up in 2016 and are predominantly funded by the federal government. However, each network covers a region, and they're set up mostly to support primary care. However, they also have a role in supporting health at a local level in communities for the region that they cover as well. So they're a little bit unique because although they are set up and funded predominantly by the federal government, they do operate as an independent organisation.
Okay. And what do you do in your role there?
Yeah, so I'm 3 months in now, and I just had my end of probation review the other day, and I still have a job, so that's exciting. And my role is, as I said, the organisation went through a big restructure last year, so this was a new role that was created. And historically, primary health networks have more been involved in integrated care and primary care. So, making sure that that community members have that person-centered and integrated care through from the tertiary system into primary care. However, what's really exciting is that they are starting to move more in, particularly in Healthy North Coast, where I work, are starting to take a much more population health approach and integrating preventive health into all areas of healthcare, which again was something that really excited me about the organisation. So that's part of my role as population health coordinator, is bringing that preventive health focus and lens, but really looking at what are the needs and what are the strengths of our region and the communities in our region, and what can we do to support those communities. So there's a couple of areas that I really focus on around immunisation. So the region I work in has lower immunisation rates for children, so looking at how we can improve those. Also things like cancer prevention and increasing cancer screening rates, but really taking a holistic approach and to the health of the region, and looking at those outcomes and what we can achieve.
Interesting stuff. So, um, how big of a team do you work on right now?
Yeah, so our organisation has somewhere between, I think, 60 and 70 people, and my team, it's a little bit different because I have gone from working in a really collegiate kind of health promotion team with lots of people in the same role, whereas I've come into a new organisation where my role is the only one of its kind. So I don't necessarily work within a team as such, but what's really great is that we have a range of teams within, different areas and different functions. So my role really collaborates with lots of different teams in the organisation.
Okay. And congrats on having your job still after your 3-month evaluation. So,
Thank you.
what do you find most exciting and least exciting about your role?
Ooh. Most exciting is getting to take, like, for example, this week I got to put together a population health strategic framework. So really coming in fresh and saying, what, in terms of population health and preventive health, what do we want to do and what do we want to achieve? And I got to really take ownership and leadership in that. And that really excites me because I think it's not often that happens, and that you get to have that autonomy and that contribution. But again, being a new role, it probably gives a little bit more space for that, which is really exciting. Not as exciting. Oh, what would I say? Admin. Like the annoying little things that you just have to do, and that, but then sometimes you get to the end of the day and you've spent all this time doing annoying little admin tasks and you feel like you haven't achieved anything. But I'm sure that that's pretty common in most jobs.
Yeah, absolutely. Like having to respond to a bunch of emails. You don't even realize how long it takes her to do all those little tasks, but it definitely does add up.
Yeah.
Moving right along, so you have recently started up a website, the publichealthnerd.com. Why did you start this website?
Yeah, so about, would have been the beginning of last year, this idea and concept popped into my mind, and I was, like I said, through my experience at uni, I really enjoyed mentoring and talking to students and other people in, grads and early career about how did you get a job in what you do, and how did you get there. And I know for me, when I was a student, that was so valuable for me, especially walking into an area where their jobs were so scarce. It was kind of, you were like, well, how am I ever going to get any experience doing this? But you know that it's what you want to do, and you see other people doing it, so you know that it's possible. And I'd often get just people messaging me on LinkedIn and connecting and saying, looking for jobs or doing this. Can you give me some feedback or advice, or just kind of wanting to know my story and how I got to where I've come. And I thought it'd be really cool to put a resource together, or a platform where I can actually start talking to people about this stuff, but sharing that, because often it was just one-on-one conversations, and that's awesome. But I thought it would be really cool to sort of bring this to light and chat about it more publicly, but also because it's such and you would know this, that people don't understand what we do. And it's so funny. I was talking to an old colleague the other day who I actually interviewed, and And she said that her partner, who, you know, they've been together for like 8 years, and she said for 2 years he thought I was a dietitian. And it's not very well understood. And I think COVID's probably shining the light on public health now, but that's only, you know, infectious disease is such a just one tiny small part of what public health does.
Yeah, that is absolutely correct. And I feel the same way, like creating my platform to really get the word out about public health, because no one does know what we do. And then I feel like there just aren't the resources out there for students to find different paths and really understand what they want and what they can do. So I thank you for that.
Yeah.
And I look forward to promoting your website going forward and collaborating if need be. I'm all
Yeah. And it was so exciting when I found you recently, because when I looked, you know, 24 months ago, I couldn't find anything because I just wanted to see what else was out there. And there's just not many resources out there for these kind of conversations and platforms. And we do have some peak bodies here that do have good resources and things like that. But it was more that those, you know, just talking to people who are in the same situation and having those relatable conversations and really practical conversations, and just things like I said, when I applied for my first government job, I had no idea what I was doing. And I was lucky that I had my sister who worked in the same organization who could help me through that process. But I just find those things are so helpful. And any help that I can give to other young people, grads, early career professionals wanting to get ahead and you know, find the job that they want and work their way through their career in public health, hopefully I can do my bit, because we need more people.
Yeah, absolutely need more people, and thank you for doing that. So does your sister also work in public health?
No, she's a psychologist, so she's a
Okay.
clinical psychologist, but she worked for the state health department.
Okay, awesome. So I know before we started interviewing, we chatted a little bit about motivational interviewing, because I know you did some training around that, and I think it's an important topic to touch on. So can you just explain what it is?
Yeah, so it's a funny name because it you know, motivational interviewing, but it's in no way an interview as such. It's essentially a counselling modality and also a behaviour change modality that's used in counselling, and it really does work with people in terms of where they are at. Sorry, so you're meeting people where they are at in their journey. And in my experience working at the Quitline service, that was around smoking cessation. But motivational interviewing is used in all types of scenarios and health behavior change and otherwise. So yeah, I don't know if I can give this question justice.
Fair enough, and no problem whatsoever. So moving you along to the last part of the show, the Furious Five, the 5 questions I ask all guests. So number one, what advice would you give to a student trying to pursue a career in public health?
Get experience. I think this is really you just can't, like, it's just so valuable. Just get experience, and it doesn't have to be paid experience, whether it's experience through your studies, internships, prac like I did, using your networks. I think I stress this all the time. Just getting relevant experience is super important. And I think often people think, well, because you'll go for a job and it says you need experience, but you might not necessarily have the experience yet. But it's more about building experience in different areas that might not necessarily be cookie cutter public health experience, but it might be close, or it might be building those key core skills that I talked about, like project management, stakeholder engagement, relationship building, those things that can really translate across.
Yeah, and I think that's a theme that definitely echoes getting an experience and building those core skills. So number two, if you were talking to someone wanting to get into your position, what advice would you give them?
I'd say take risks if you can, and your life can put up with that and handle it, then, and your family, then I'd recommend taking risks.
Okay. Yeah, fair enough. Number three, what's something you're working on improving in your life right now?
Do you mean personally or professionally?
Either one or both.
Yeah, okay. So I'd say professionally, at the moment, I'm working on really incorporating more strength-based approaches into my practice. So often in public health, in health promotion, we really start from a deficit point of view. We look at what are the needs and what's missing and where are the gaps and how can we fill those. But what I'm really trying to focus on more is looking at what are the assets that exist, what's already happening in communities that's working and that's positive, what are the strengths that exist and how can we build on and capitalize on those.
Yeah, and I think that's very important to take strength-based approaches to public health. Number 4, professionally, do you recommend anything? So this could be like a book, a podcast, or anything else, any other resource.
It's funny because I listen to a lot of podcasts, but apart from yours, I don't really listen to any public health type podcasts. But I don't think there is many, to be honest. I couldn't find many, unless you have some recommendations. But we can come back to that. One thing that I would recommend is it's a little bit of a long read, but I went to a conference last year and it was the International Union, gosh, I can't remember the acronym now, International Union for Health Promotion Education, IUEH. Gosh, that's terrible.
I'll look it up and make sure to get it
Yeah,
correct.
yeah, awesome. So I went to the World Conference for Health Promotion last year in New Zealand, and the theme of the conference was planetary health. And it just opened my eyes to a whole new world and a whole new way of thinking. And there was one particular report or paper essentially that kept coming up and that I really made the effort to go and have a look at afterwards. So it's by the Lancet and it's called Safeguarding Human Health in the Anthropocene Epoch Report of the Rockefeller Foundation. So it's a Lancet Commission on Planetary Health. And that's a bit of a mouthful and is I think like 56 pages, but it's, if you could just skim through it and have a look. But I think, yeah, planetary health just really opened my eyes and gave me a bit of a new look. And I think because for me, I'm really passionate about the environment and climate change and what I personally, the impacts that I personally have on the planet, but also as a population and what we do. And when I kind of brought that in with my public health lens and focus and brought it all together, I was like, yeah, that's really cool.
Okay, yeah, and that is really awesome. And I know like One Health is something that's been popping up a lot more, like focusing on, I want to say it's human health, environment health, and there might be something else, animals health, yeah, human environment and animals health. And that's a topic that's been popping up a lot more, but I'll definitely link to that in the show notes. So
Cool.
last but not least, where can people connect with you?
Feel free to connect with me on LinkedIn, or alternatively check out my new website, thepublichealthnerd.com. It's a little bit of a work in progress at the moment and I'm working on a podcast at the moment, but if you hop onto that website and click on podcast, you can subscribe, so I will let you know when it drops.
Yeah, and definitely go and subscribe. I've already subscribed, so I will know when it drops. I hope you do too. But thank you so much, Ava, for coming on the show. I appreciate your time, and I really appreciate you reaching out to be on the show in the first place. And that was really nice, and I really enjoyed this episode. And I look forward to continuing to connect with you and just learning and growing and trying to shine more light on public health. So thank you for being here today.
Thank you. It's been great and I look forward to having you on the Public Health Nerd.
Yeah, awesome. I look forward to that too. And hopefully we can connect sometime outside of COVID.
Yes.
Yeah,
Sounds good.
yeah, I'd love to come down to Australia sometime.
Yeah, have you been?
I have not as yet.
It's beautiful. I'm sure you'll love it here and you're very welcome once the borders are open.
No, absolutely. Well, thank you so much for coming on the show, and I look forward to sharing this episode. Well, I'm glad that I could find some time in my day to meet with Ava today. If you know, I'm in Alaska, Ava is in Australia, so the time difference there is quite remarkable, but thankfully we were able to schedule some time together. And I hope that you gained a lot of value from this episode. I knew I learned a couple of things about Australian public health that I didn't know before, and I hope you did. And I just want to make sure that people know that public health is global and that we have public health all around the world, and different countries use different systems, and it's just very interesting. But if you have not left a review as yet, definitely review. If you are on YouTube, make sure to subscribe, like, and comment. And if you are listening to this on a podcast platform, subscribe, share, review. I appreciate that a lot. And I hope you come back and listen to the next episode. If you want to get in contact with me, you can just look me up on Instagram. That's the PH Millennial. And yeah, so thank you so much for listening, and I will see you next week. Well, you will hear me or see me next week. Have a great week, everyone. Public Health Millennial out.